Last year, Youth Cancer Europe adopted white paper on 5 topics of action, and cross-border healthcare was the second topic as a priority on our list. And we know we have a directive which was supposed to be implemented 5 years ago. We have a regulation which is enforced for more than a decade, and yet we know that the patients who are trying to access the healthcare abroad within the European Union are facing huge obstacles. Only 200,000 cases per year, patients are moving and crossing borders under the directive. Just within the rare diseases, we have 36 million of rare disease patients living in the EU that should benefit from that directive. And 4 out of 5 people are totally not aware of these rights, so something is definitely wrong.
It was stated in the review made by the European Commission, it was stated in the European Parliament resolution that unfortunately the awareness is still low. Many of European citizens do not know about the directive. Even more than that, they don't know about the national contact points. We have a lot of barriers, from prior authorization to the reimbursement of the abroad treatments. And these barriers, this lack of awareness should be overcome, should be changed in the near future.
We should have a serious debate at the European level about how to change this directive. I would scrap the pre-authorization, for instance, mechanism in cases of cancer or other serious diseases. It's not acceptable when you have cancer, how we saw the young people today, to see how bureaucratic the national governments are dealing with these cases. It's awful. If you have this bad luck in life, you should focus on your health, on your life, not on fighting with the bureaucracy.
There are some member states who are really creating practical obstacles to the implementation, so I think the European Commission is the one that should take the initiative. The European Commission is the guardian of the treaty, so they are the ones who should control whether member states are protecting the patient's rights, whether the procedures for granting authorization are taking too long, etc. So I think we should put as much pressure as possible to the European Commission to really do their work in controlling the member states in the way they're implementing the EU law.
We need to make sure governments are implementing the directive, not say they implement the directive on paper, but that we as patients would start feeling it. We heard from the MEPs in the room who have either worked on that report, who are either did PhD on cross-border healthcare, or who are in the group of MEPs against cancer. So there is a forum to have that discussion. We are in. It is question who else will be joining us.